Hi class, it's Tony again. This week my presentation will be on explaining a piece of EMS equipment. And what I'm going to explain to you this week is actually a piece of equipment we have called the AutoPulse. The AutoPulse is made by Zoll Corporation, and we use Zoll's defibrillator, heart monitor as well. And what the AutoPulse actually is a device that actually gives CPR. And it frees up some hands. It does a very effective job of CPR. It's actually a lot better than a human. We'll talk about that in a minute. The Zoll itself is kind of, if people know what a thumper is the old style machine used to do CPR. But the thumper was a little traumatic on patients because it had a focal point where it pushed on the chest, much like a person. But it did a mediocre job of actually returning spontaneous circulation to patients. Okay, so today what we're going to do is show you parts of the AutoPulse and how it works, and then we're going to demonstrate its use, not on a person, but we're going to do it on a piece of equipment. So anyway, we'll start with the AutoPulse itself. Okay, the AutoPulse itself, if you take a look at it, the way it's designed is that it has an arrow pointing up. The arrow pointing up signifies the head of a patient. And this here is the outline of the shoulders, the underarm area, and this line here is the imaginary line that kind of goes across your chest here. So you picture a person on the AutoPulse. Everybody's different sizes, but this AutoPulse is designed to be used for people 18 years and older. So you'll have a pretty good fit for most people, average size people. Okay, the Zoll has a battery right here, and we've got a backup battery right here. Okay, always check your batteries every day. Okay, right here you're going to see a little green light comes on, shows that the battery's good. Okay, now we have a fresh battery in the Zoll. That's our backup. We're going to turn the Zoll on. Okay, and the screen here essentially shows the strength of the battery and tells you what to do. You're going to pull up the life band. It's telling you essentially. So what you do is you lay your patient, first of all, the best thing to do in the best case scenario is to put the AutoPulse on a backboard, and you secure it to the backboard with straps, and then you put the patient on the AutoPulse itself. And there's actually some straps here that you connect to hold the patient to the AutoPulse, but that can come later. First, you want to get the person situated on the AutoPulse. Okay, we have bands here. You see right here 1, and you see 2. Okay, it tells you exactly what to do. You put this on the patient, and then you close this on top of the patient. Okay, what we're going to do today, we don't have a patient, a live patient, and I was unable to get a hold of a test dummy or a mannequin, so we're going to use our airway bag. It's the shape of it will allow us to demonstrate the function of the AutoPulse. Okay, we're going to put our patient / airway bag on the AutoPulse. Okay, number 1, number 2. Now keep in mind that we use this piece of equipment all the time, so actually when you have a team of people doing this, it's a lot quicker than the way I'm showing here. Okay, now you're going to hold up the band, and you're going to push the button on the side that says to start. Okay, and what it does is it's going to size up the patient. Now, this is the AutoPulse. Okay, now it doesn't look like it's doing much, but studies have shown that the way this squeezes a person's torso, it has very effective CPR. What it's doing, it's in a mode that actually allows CPR, compressions, and breathing. So you'll stop, and then you breathe for your patient. And then it'll resume automatically. Okay, we're actually going to stop it right now. Okay, so that's essentially how the AutoPulse functions. Okay, now this keep in mind that this is simply a tool, but it's an effective tool that in most cases it does actually have very good circulation. It's an adjunct for very good circulation resuscitation. It brings about circulation. Sometimes you try to get a vein during a cardiac arrest, and sometimes it's difficult. So the auto pulse will actually circulate the blood well enough to actually have veins pop up, so you're able to palpate them. And so anyway, essentially that's the auto pulse and the life band. That's a demonstration, and that's it for this week. We'll see you next week. Thank you.